Joint pain is a common complaint that affects people of all ages. Whether it's a dull ache or a sharp, stabbing sensation, joint pain can interfere with daily activities and reduce your quality of life. In this video, we'll explore the most common causes of joint pain, how to recognize when it might be a sign of something serious, and what steps you can take to manage or prevent it. Understanding the underlying reasons for joint discomfort is the first step toward effective relief and better joint health. Let's begin by looking at what joints are and why they sometimes hurt. Joints are the connections between bones that allow your body to move. They come in many forms, such as knees, elbows, shoulders, and hips. Each joint is made up of bones, cartilage, ligaments, and synovial fluid, all working together to provide smooth movement and flexibility. When any part of a joint is damaged or inflamed, pain can result. Understanding the structure of joints helps us appreciate why they are vulnerable to injury and disease, and why joint pain is such a widespread issue. Joint pain can present in many ways. Some people experience a constant ache, while others feel sharp pain only during movement. Swelling, redness, warmth, and stiffness are also common symptoms that may accompany joint pain. These symptoms can make it difficult to perform everyday tasks, such as walking, climbing stairs, or even gripping objects. Recognizing these signs early can help you seek the right treatment and prevent further joint damage. Joint pain can be classified as acute or chronic. Acute pain comes on suddenly, often after an injury or infection, and usually resolves within a few days or weeks. Chronic pain, on the other hand, persists for months or even years and may be related to ongoing conditions like arthritis. Knowing whether your pain is acute or chronic can help guide your treatment options and expectations for recovery. One of the most common causes of joint pain is injury. Sprains, strains, and fractures can all damage the structures within a joint, leading to pain and swelling. Sports injuries, accidents, or even overuse from repetitive motions can strain ligaments and muscles around the joint. Immediate pain after a fall or twist is often a sign of injury, and it's important to rest and seek medical attention if the pain is severe or accompanied by swelling and bruising. Arthritis is a leading cause of chronic joint pain. There are many types, but the most common are osteoarthritis and rheumatoid arthritis. Osteoarthritis results from wear and tear on the joints over time, while rheumatoid arthritis is an autoimmune condition where the body attacks its own joint tissues. Both can cause persistent pain, swelling, and stiffness, often worsening with age or activity. Osteoarthritis is the most common form of arthritis, especially in older adults. It occurs when the cartilage that cushions the ends of bones wears down over time, causing bones to rub against each other. This leads to pain, swelling, and reduced mobility. Osteoarthritis usually affects weight-bearing joints like the knees, hips, and spine, but it can also impact the hands and fingers. Rheumatoid arthritis is an autoimmune disease that causes the immune system to attack the lining of the joints. This leads to inflammation, pain, and eventually joint damage. Unlike osteoarthritis, rheumatoid arthritis often affects joints on both sides of the body, such as both wrists or both knees. Early diagnosis and treatment are crucial to prevent long-term joint destruction. Besides osteoarthritis and rheumatoid arthritis, there are other forms of arthritis that can cause joint pain. Gout, for example, is caused by the buildup of uric acid crystals in the joint, leading to sudden and severe pain, often in the big toe. Psoriatic arthritis is linked to the skin condition psoriasis and can affect any joint. Infectious arthritis occurs when a joint becomes infected by bacteria or viruses, requiring prompt treatment. Bursitis and tendinitis are two conditions that can also cause joint pain. Bursitis is the inflammation of the bursae, small fluid-filled sacs that cushion the joints. Tendinitis is the inflammation of tendons, the tissues that connect muscles to bones. Both conditions are often caused by repetitive motion or overuse and can result in pain, swelling, and limited movement in the affected joint. Infections can sometimes spread to the joints, causing a condition known as septic arthritis. This is a serious medical emergency that requires immediate treatment. Symptoms include severe pain, swelling, redness, and fever. Bacteria, viruses, or fungi can enter the joint through the bloodstream or after an injury. Prompt medical attention is crucial to prevent permanent joint damage. Autoimmune disorders, such as lupus and ankylosing spondylitis, can also cause joint pain. In these conditions, the immune system mistakenly attacks healthy tissues, including the joints. This leads to chronic inflammation, pain, and sometimes damage to other organs. Autoimmune joint pain often comes with other symptoms like fatigue, skin rashes, or fever. Certain medical conditions can contribute to joint pain. For example, hypothyroidism, fibromyalgia, and even some cancers can cause aches and discomfort in the joints. Blood disorders and metabolic diseases may also play a role. If you have unexplained joint pain along with other unusual symptoms, it's important to consult a healthcare provider for a thorough evaluation. As we age, our joints naturally undergo wear and tear. Cartilage thins, ligaments become less flexible, and the risk of developing arthritis increases. Older adults are more likely to experience joint pain, especially in weight-bearing joints like the knees and hips. Staying active and maintaining a healthy weight can help reduce the impact of aging on your joints. Carrying excess weight puts additional stress on your joints, particularly the knees, hips, and lower back. Obesity increases the risk of developing osteoarthritis and can make existing joint pain worse. Losing even a small amount of weight can significantly reduce joint pain and improve mobility, making weight management an important part of joint health. Your daily habits can influence joint health. Lack of exercise, poor posture, and repetitive movements can all contribute to joint pain over time. On the other hand, regular physical activity, stretching, and ergonomic adjustments at work can help keep your joints flexible and strong. Making small changes to your routine can have a big impact on joint comfort. While most joint pain is mild and temporary, certain signs indicate a more serious problem. If you experience severe pain, sudden swelling, inability to move the joint, or fever, it's important to seek medical attention right away. These symptoms could signal an infection, fracture, or other urgent condition that requires prompt treatment to prevent complications. Certain symptoms should never be ignored. These include joint pain with fever, unexplained weight loss, night sweats, or pain that worsens rapidly. If you notice deformity, inability to bear weight, or if the joint looks very red and feels hot, these are red flags that require immediate evaluation by a healthcare professional. Diagnosing the cause of joint pain often starts with a detailed medical history and physical examination. Your doctor may ask about the location, duration, and severity of your pain, as well as any associated symptoms. Imaging tests like X-rays or MRIs, and blood tests may be ordered to help identify the underlying cause and guide treatment. During a physical exam, your doctor will check for swelling, redness, warmth, and range of motion in the affected joint. They may also look for signs of injury or deformity. This hands-on assessment helps narrow down possible causes and determine if further testing is needed. Imaging tests such as X-rays, MRIs, or ultrasounds can provide detailed pictures of your joints. These tests help identify fractures, cartilage loss, inflammation, or other abnormalities that may not be visible during a physical exam. Imaging is especially useful for diagnosing arthritis, injuries, and infections. Blood tests can reveal signs of inflammation, infection, or autoimmune activity. For example, elevated levels of certain markers may suggest rheumatoid arthritis or lupus. Blood tests are also useful for detecting infections that could be causing joint pain, helping your doctor choose the right treatment. In some cases, your doctor may perform a procedure called joint aspiration. This involves using a needle to withdraw fluid from the affected joint. The fluid is then analyzed for signs of infection, crystals, as in gout, or inflammation. Joint aspiration can provide valuable information for diagnosing the cause of joint pain. Treatment for joint pain depends on the underlying cause. Options range from rest and physical therapy to medications and, in some cases, surgery. The goal is to reduce pain, restore function, and prevent further joint damage. Early intervention can often lead to better outcomes and improved quality of life. Resting the affected joint and avoiding activities that worsen the pain can help speed up recovery, especially after an injury. However, complete immobility is rarely recommended, as gentle movement and stretching can prevent stiffness and promote healing. Finding the right balance between rest and activity is key. Physical therapy is a cornerstone of joint pain management. A trained therapist can teach you exercises to strengthen the muscles around the joint, improve flexibility, and reduce pain. Physical therapy can also help correct posture and movement patterns that may be contributing to your discomfort. Several types of medications can help manage joint pain. Over-the-counter pain relievers like acetaminophen or nonsteroidal anti-inflammatory drugs, NSAIDs, are commonly used. In some cases, your doctor may prescribe stronger medications, corticosteroid injections, or disease-modifying drugs for autoimmune conditions. Always use medications as directed by your healthcare provider. Making healthy lifestyle changes can have a big impact on joint pain. Maintaining a healthy weight, eating a balanced diet, and staying physically active all support joint health. Avoiding smoking and excessive alcohol consumption can also reduce inflammation and improve your overall well-being. Some people find relief from joint pain through alternative therapies such as acupuncture, massage, or herbal supplements. While evidence for these treatments varies, they may be helpful as part of a comprehensive pain management plan. Always discuss alternative therapies with your healthcare provider before starting them. In severe cases where other treatments have failed, surgery may be necessary to relieve joint pain. Procedures can range from minimally invasive arthroscopy to joint replacement surgery. Surgery is usually reserved for cases of advanced arthritis, severe injury, or when joint function is significantly impaired. Prevention is always better than cure. Protecting your joints from injury, maintaining a healthy weight, and staying active are key strategies for preventing joint pain. Using proper techniques during sports or physical activities, and taking breaks during repetitive tasks can also help keep your joints healthy. Regular exercise strengthens the muscles around your joints, improves flexibility, and helps maintain a healthy weight. Low-impact activities like swimming, cycling, and walking are especially good for joint health. Remember to warm up before exercise and cool down afterward to prevent injury. A balanced diet rich in vitamins and minerals supports joint health. Foods high in omega-3 fatty acids, such as fish and flaxseed, can help reduce inflammation. Calcium and vitamin D are important for bone strength, while antioxidants from fruits and vegetables protect joint tissues from damage. Staying well hydrated is essential for joint health. Synovial fluid, which lubricates the joints, is mostly water. Dehydration can lead to joint stiffness and discomfort. Aim to drink plenty of water throughout the day, especially if you're physically active or live in a hot climate. Maintaining good posture reduces unnecessary stress on your joints. Whether you're sitting at a desk, standing, or lifting objects, proper alignment helps distribute weight evenly and prevents joint strain. Ergonomic chairs, supportive shoes, and mindful movement can all contribute to better posture and less joint pain. Workplace ergonomics play a big role in joint health. Adjusting your chair, desk, and computer monitor to the right height can prevent strain on your wrists, shoulders, and back. Taking regular breaks to stretch and move around also helps reduce the risk of developing joint pain from repetitive tasks. Wearing supportive shoes can make a big difference in joint comfort, especially for your knees, hips, and lower back. Shoes with good arch support and cushioning help absorb shock and reduce the impact on your joints. Avoid high heels and worn-out shoes, as they can contribute to joint pain over time. Chronic stress can worsen joint pain by increasing inflammation in the body. Practicing stress management techniques such as meditation, deep breathing, or yoga can help reduce pain and improve your overall well-being. Taking time for relaxation and self-care is an important part of joint health. Some supplements, such as glucosamine, chondroitin, and turmeric, are believed to support joint health and reduce pain. While research is mixed, some people find these supplements helpful. Always consult your doctor before starting any new supplement, especially if you have other health conditions or take medications. If joint pain persists for more than a few days, or if it interferes with your daily activities, it's time to see a doctor. Early evaluation can help identify the cause and prevent complications. Don't ignore joint pain that is severe, sudden, or accompanied by other concerning symptoms. When you visit your doctor for joint pain, be prepared to discuss your symptoms in detail. Ask about possible causes, recommended tests, and treatment options. Understanding your diagnosis and the steps you can take to manage your pain will help you make informed decisions about your health. Living with joint pain can be challenging, but there are many strategies to help you cope. Staying active, maintaining a positive outlook, and seeking support from friends, family, or support groups can make a big difference. Remember, you're not alone, and effective management is possible with the right approach. There are many myths about joint pain, such as the belief that only older people are affected or that exercise always makes it worse. In reality, joint pain can affect anyone, and regular, gentle exercise is often beneficial. Understanding the facts can help you make better choices for your joint health. To sum up, joint pain can have many causes, from injuries and arthritis to infections and lifestyle factors. Most joint pain is not serious, but certain symptoms require immediate attention. Early diagnosis and treatment can help you manage pain and maintain a healthy, active life. Remember to listen to your body and seek help when needed. Joint pain is a common issue, but with the right knowledge and proactive care, you can manage it effectively. Stay informed, take preventive steps, and don't hesitate to reach out to healthcare professionals if you have concerns. Your joints are essential for movement and independence, so take good care of them for a healthier, more active future.